Hello and welcome to Askimo TV. We're talking today to Daniel Waller. Daniel is a primary care and hospital optometrist based in London. Hi Daniel, how are you?
Hi, I'm fine, thank you, and I hope you're okay as well.
Very well, thank you, Daniel. Daniel, today's discussion is about diabetic eye disease. So I'm going to start off with, what is diabetic eye disease?
In one sentence, the biggest cause of blindness in the population under 60 in the Western world.
What causes it and who is at risk?
Anyone who's diabetic is at risk, and it is a consequence of general diabetes, which is why it's incredibly important that anyone who is diabetic or has suspected as being diabetic is seen by an eye care professional at least once a year.
What can happen if the condition's left untreated?
If left untreated, worst case scenario, you lose your sight.
What are some of the signs and symptoms of diabetic eye disease?
I describe diabetic eye disease as a bit like having an old hose going from your tap to a very valuable plant at the end of the garden. Diabetes weakens the blood vessel walls so that after a period of time, if that hose is very weak, water starts leaking out, causing weeds where you don't want it to be, and then causes a plant at the end of the garden not to get the water it needs, and therefore it will eventually die. And in the same way, the very early signs of diabetes is we see little spots of blood on the light sensitive film, the retina at the back of the eye, and then the rest of the disease pathway follows.
How do you diagnose this condition? And once you've diagnosed it, what treatment options are available?
General diagnosis now is good views of the back of the eye, either using fundus photography, that's taking a nice picture of the back of the eye, and comparing these pictures over the years. Diabetes is something that one is going to have to live with, and very subtle changes can be seen from those photographs. It may just be a case of advising the patient, hey look, we just need to control your blood pressure. You know what, cut out the sugary snacks every once in a while, or maybe have a chat with the dietitian. It may, though, require the need of laser photocoagulation, if you imagine, going back to my hose, to seal up some of the leakage that's going on at the back of the eye.
What is the prognosis for recovery after treatment?
The prognosis after treatment is generally very, very good, depending at what stage the diabetic eye disease has been caused.
And just to end off, is there anything that diabetics should or shouldn't do in order to try and prevent diabetic eye disease?
In order not to prevent diabetic eye disease, I would be saying good control of the blood sugar levels, but interestingly enough, good control of the blood pressure is incredibly important. And if we go back to my hose scenario, you can then imagine if you've turned up the tap a little bit, maybe if one smokes, or maybe the bore of the blood vessel has narrowed, and you need to take your anti-cholesterol medication, you can then imagine how if you squeeze the hose, that would increase the pressure there. So it all goes back to good control and keeping everything balanced.
Thank you, Daniel. Thank you so much for talking to me today.
It's a pleasure.